I am an assistant professor here with the School of Pharmacy. I'm also a clinical pharmacist and I practice in the ambulatory care pharmacy realm. And I'll speak on what that is a little bit. And I'm also the pharmacy director for our Saturday clinic for the uninsured, which is really exciting and really unique, a unique aspect of MCW. And it's a free clinic that is run by both pharmacy and medical students. And those are not overly common, especially affiliated with pharmacy students nationwide. So I like to just highlight that and talk about what it is that I do at SCU or Saturday Clinic, and then what it is that SCU does. So I'll touch on a little bit of this throughout my presentation, but again, at any time you have any questions, please don't hesitate. Starting off a little bit to just introduce myself personally before I dive into the professional side of things. I love to travel. Travel is a huge passion of mine. On the top left, my husband and I are in a photo. We're hiking in Banff, Canada. In the top middle photo, that's my brother and I. We are both pharmacists and went to a 4-year pharmacy school, actually graduated together. And after our first year of pharmacy school, we decided over our summer break to backpack Europe for 6 weeks together, which was just an incredible experience. The most recent, like personal big change in my life was that my husband and I welcomed our baby girl, Lila, in June of this year. I can't believe that in 2 days she's going to be 8 months old. I don't know where the time went. We also have 2 fur babies on the bottom right. So one, our black and white cat is named Sassy, and our all black cat is named CJ. So they're our original babies, and they don't mind their sister, but I think they would, if they could, be the only babies in the house. I also did some volunteer work in undergrad, and in the bottom left photo, I am in Tanzania, Africa, and was volunteering there and ended up meeting the man pictured there who was really interested in medicine and health and was hoping to become a physician and be able to provide care to members of his village. So little bit about me, some kind of fun moments in my life, but diving into probably why you're here, more so learning about my pharmacy background and what it is I do today. So my pharmacy journey started, I did undergrad and pharmacy school at North Dakota City in Fargo, right on the border of Minnesota. And that was a traditional 4-year program. I didn't even know that accelerated programs existed at that point. Had I, and I think there was few and far between, had I known, maybe I would have gone to a different school, but I went the traditional 4-year route and, appreciated school, thought while I was in school was doing an internship with a local Walgreens and very much saw myself graduating and being in more of the community pharmacy role, staying in one of like a retail setting or an outpatient pharmacy because I really enjoyed what I did. However, on my final year of pharmacy school, that's, every student has all rotation year. We call it AP year, APPE year. I early on in that year had a rotation where it was an elective and I was on an academic rotation and I was teaching in the patient care lab that we had on campus. And I really fell in love with educating and just got really passionate about it and thought, okay, maybe I don't necessarily want to do community or retail pharmacy. Maybe I really want to teach. And some of our faculty members also worked at one of them, also did their practice experience at a Walgreens. And I thought, oh, that would be really cool. So then I knew I really wanted to go into a pharmacy residency program. So, once I graduated, I wanted to do a year or 2 of residency training, likely to help kind of bolster my education and be able to do something in academia, which I, prior to AP year, didn't really know that that's where my future was going to lead me. My next rotation right after that academic one on campus was in ambulatory care pharmacy. Have you ever heard of AmCare? Are you familiar with AmCare, Emily, at all? Okay, yes. Well, so in that residency, or excuse me, in that rotation, I was with another faculty member who practiced and utilized collaborative practice agreements in a federally qualified health center, basically like a primary care clinic or family medicine clinic. And they were able to see patients for diabetes, high blood pressure, high cholesterol, and this faculty member also had expertise in hepatitis B treatment. And so she'd get a lot of referrals to start patients on a Hep B treatment and provide education. And I just was really in love with the patient care because that's what I loved about retail was getting to know people, but there's only so much you can do, right? When you have a line of patients behind someone who's checking out. Whereas in the ambulatory care setting, you were sitting down and patients were coming and seeing you in an office setting, and you really had the time and expertise to get to know them and build a relationship. And I really found that I loved that. Um, and I loved that there were follow-ups, right? Like I was going to see them monthly or maybe it was every 2 months. Whereas more of the hospital side of things or acute care, as we call it, the idea is that a patient gets hospitalized, you stabilize them, and then hopefully, right, if everything goes well, you never see them ever again because you want them to remain healthy and out of the hospital. And I really wanted those relationships. So I found that ambulatory care pharmacy really spoke to what I wanted. So when I started looking at residency programs that were available nationwide, I was looking for residency programs that would give me the best of both worlds of what I had discovered of teaching as well as that ambulatory care pharmacy practice. And I found a residency program I fell in love with at Concordia University, Wisconsin, and they offered a 24-month or 2-year PGY1 pharmacy residency where 50% of your time was split teaching and 50% of your time was split in that ambulatory care pharmacy setting. You also got a master's in education over the 2 years, and that I did not see at any other residency program that had both teaching and AM care. So I really felt interviewed and was lucky enough that we matched and I started as their resident. Over the 2 years, I taught, of course, everything builds. Started off in the patient care lab, kind of facilitating and educating learners, and then started teaching a few lectures. And then by the end of my second year, I was teaching a full course within their program. Same thing with the pharmacy practice side of things. So I started off in a clinic, observing my preceptor and then slowly kind of taking on more patient visits to at the end of the first year having my own independent clinic day, in addition with days where I was with her. And then my second year actually went out and started a pharmacy practice site at a family medicine clinic through Ascension where there had never previously been a pharmacist. And I did utilize those collaborative practice agreements, really what I would say is like a contract between a physician and a pharmacist that basically allows the pharmacist for certain disease states, so depending on what that's decided, that they are able to work with the patient and order medications, order lab work, and they're just given, a lot of authority and the ability to be a provider in that setting. And so I worked with a CPA that included diabetes care, hypertension or high blood pressure, hyperlipidemia or high cholesterol, asthma, COPD, and then smoking cessation. So giving people education, the tools, medications to help them quit smoking. So that was a great experience. And when that was coming to a close, I, of course, was hoping to find a faculty position. It just so happened that MCW was hiring and their mission and values really matched what my educational mission and values are. And so I was lucky enough to get a position here and have been with MCW since 2021. Any questions so far on kind of what my education looked like or what that residency program looked like?
I just had like a quick question about like how many residency programs did you apply to?
Yeah, so, I applied to 11. I got 8 interviews out of the 11 places I applied. Not all of them were like where I matched at Concordia. Some of them,
Mhm.
like one, for example, was Froedtert, where I applied for their ambulatory care program. But within that, you have the ability to get a teaching certificate through MCW or Concordia. And so I knew even if that wasn't my ideal choice because I really wanted somewhere where I could do that 50% teaching, 50% practice. But I knew that either way, I would find a way to kind of hopefully you be in academia and be an educator. But I just had a couple programs that really spoke to me where there was more of that teaching side of things. But everyone is different. I always
Mhm.
recommend to my students when I talk to them not to put all of their eggs in one basket and to at least apply to 4 places, only
Mhm.
because for some places, um, I applied and I interviewed and I found at the interview that, before going into the interview, maybe it was like my top third place. And I did the interview and after I did all the interviews, what I thought was going to be my rank list to say this is my first program, this is second, third was very different from what I originally thought. So I always tell people at least apply to 4 so that you hopefully will get multiple interviews, but then if one place looks great on paper, but at the interview doesn't really speak to you, or it's maybe different than what you expected, that you don't feel stuck. So
Mhm.
it varies student to student. I would say for a lot of students that I write letters of rec for, they're applying to somewhere between 5 and 8 programs, likely.
Okay,
Yeah,
thank you.
so great question. Just to cover a little bit about what I do teach in the program, I will say this is not at all an exhaustive list, but the 2 main areas or main courses that I teach in are our endocrine or our IS integrated sequence endocrine course, which occurs in session 5 of the program. So it's you finish all of year 1, there's 4 sessions per year, and then session 5, so the start of your second year in the program is when you would be taking endocrine. And I teach a lot of the diabetes related content within that course. You'll also see that that ties a lot into what I practice, and I would say arguably diabetes is definitely my passion area, at least for pharmacy practice. So I love that I get to actually teach it within the program. So I do our introduction to clinical diabetes lecture, really talking about, how is diabetes diagnosed? How do we monitor it? How do we know someone who's been diagnosed with diabetes? How do we know if they're doing well or if they're not doing so well? What medications do we use? And then I also teach type 1 diabetes. So type 1 versus type 2 diabetes are very different in how they basically arise in our body, but they're also very different in how we treat them. So there's a lot of caveats that we have to teach specific to type 1, a lot of like pharmacy calculations related to type 1 diabetes. So a lot of just nuances that I touch on. And then I talk about diabetes complications and lifestyle. So with diabetes, the disease can really affect the entire body. So, for example, someone with diabetes is at a much higher risk of having a heart attack or stroke in their lifetime, and a much higher risk of having kidney disease and needing like dialysis or a transplant. And so we talk about some of those complications and essentially what we can do to assist our patients to prevent those complications. That's the goal. But if they do develop, how we can help treat those complications. And then with lifestyle, of course, that's important to every person to help them be happy and healthy. But also with diabetes, we know that lifestyle modifications can assist in kind of managing the disease state in addition to just, overall health. So we talk about, how we can educate patients on moving their body more, physical activity guidance, or, what they can do with what they eat or their diet to help improve their health and their diabetes management. And then I lastly teach contraception in that course because what you'll see is that I teach most of the women's health content within the curriculum. So I do course direct for our special populations course, and I teach a lot within that course. That course is at the way end of the program. So you learn about all of these disease states, for example, diabetes, right? And then at the end, we talk about them and how we apply them to special populations. So that could be pediatrics, so kids, geriatrics, or older population. That could be women's health, men's health. So, for example, I talk about diabetes in endocrine, and then we come back and we talk about what we call gestational diabetes, or when we have women who are pregnant who develop diabetes, and how we treat that and how that might be different from, someone who, for example, a 40-year-old man with diabetes and how we might treat that in a 35-year-old woman who's pregnant versus the other. I also do teach fertility, infertility, menstrual related disorders, derm disorders, for example. And then I do some LGBTQ care, so talking about inclusive care, also talking a bit about transgender health and care and how we can use medications in that instance. So special pops, I wouldn't say that we dive in and we don't get a lot of time on a lot of topics because we cover so much, but we hit a lot of topics and kind of brush the surface. But a lot of those things that we talk about, like you're not going to leave pharmacy school and know all the details of transgender care, for example. You would need like further education or residency or on the job ed training to be able to provide that care. But that's just the nature of, man, if we wanted everybody to be an expert in everything, I think pharmacy school would be 20 years. So we brush the surface. I also teach in the patient care lab and specifically teach motivational interviewing. It's a technique that you can use for patient relationship building, but also a really helpful technique to assist someone in making a healthy change. So maybe it's someone who, I keep using diabetes examples, but maybe it's someone with diabetes who drinks a lot of Mountain Dew and like drinks multiple bottles of Mountain Dew a day and knows it's not good for them, but struggles to make that change. And you can use motivational interviewing techniques to kind of assist in doing that. And then I also teach within a family medicine elective, and I teach diabetes related topics in that, as well as like some respiratory topics, so asthma and COPD. So just some of the things that I teach. Any questions at all there? Awesome. Then moving on to my clinical practice, of course, I've touched on the fact that I am an ambulatory care pharmacist, which means I work in the outpatient setting. So I'm not in a pharmacy and I'm not a hospital pharmacist. I work in a clinic. My clinic setting actually recently just changed. So I'm part of the Froedtert team now, which is really excited. So I'm on the Wauwatosa campus. So I used to be like downtown Milwaukee, but now I'm in the geriatrics clinic that's located within the specialty clinics building on that main Froedtert campus. My role or title is a clinical pharmacist. I do utilize collaborative practice agreements. As you can imagine, I still, as I said, diabetes was my passion, and that's all I did at my previous clinic. At the geriatrics clinic, that is a majority of what I still do. Of course, a lot of people that are in that older population do develop diabetes at some point. They say that if you live to be 98, you have like a 98% chance of developing diabetes, just because as we get older, that risk increases. But I do have collaborative practice agreements for the same things that I mentioned earlier, that diabetes, high blood pressure, high cholesterol, smoking cessation, and also the new thing here is anti-obesity medication. So if we have someone who has obesity then or is obese, we're able to assist them in both the lifestyle education, what they can do with how to move their body, how to eat to assist with that, but also have some medications that can be prescribed to assist as well. And then within my clinical setting, My patient visits are 30 to 60 minutes, so I'm really able to spend a lot of time with my patients. Their initial visit is always 60 minutes because it's really great to have a full hour to get to know someone, get to understand their health history, what's important to them, what motivates them, so I can really individualize care for them. And then from there, follow-ups are 30 minutes. Obviously, I don't have to gather as much information in those follow-ups. It's more so just kind of continually checking in their goals and their progress. I already mentioned I specialize in diabetes care, so there's lots that I do within that outside of just providing patient education and managing medications. I also try to get a lot of patients on what we call continuous glucose monitors. Have you ever heard of those? Yeah, like the sensors, right? I'm sure you've seen commercials for Dexcom or Freestyle Libre, the sensors you wear on your arm that will monitor your sugars at all times. They're really great, especially in our elderly population who have a higher risk of their blood sugars dipping too low instead of going too high. And if your blood sugars dip really low, you can get really dizzy. It can increase their risk of falling. Lots of things we don't want to happen, especially in this patient population. So the CGMs are great, and I do a lot of work with those, insulin titration, and then, like I said, lab monitoring, referrals to other providers if necessary, and follow up of just scheduling recurrent visits depending on what the patient needs. Questions as far as my clinical practice? Awesome. And then, like I said, I would touch on a little bit of what the Saturday clinic, or SCU for short, we call it, what I do there and what the clinic is like, or what the clinic is about. Because again, I think it's a really unique thing that I did not have the opportunity to be part of as a pharmacy student, and wish I would have had an opportunity not only to serve underserved patient populations and get fulfillment and do more in pharmacy than just what I did in my internship, but also the ability to network. Pharmacy is a small world, and also I didn't get a lot of time with other like medical students and other professional, like interprofessional kind of communication or interprofessional relationships. I didn't have the opportunity to build those as much as maybe I would have liked. So SCU is great. The photo there is myself with our other pharmacy director. On the left, Jake Dyer, who also is a faculty member within the School of Pharmacy. And then on the right was our medical director, Becky Lunt. So of course we worked very closely because we basically oversee all the students who do run the clinic. So Saturday Clinic is a free clinic, so we provide free healthcare to people in the local Milwaukee area who don't have access to patient care. And so we don't ask questions too. If someone shows up and they tell us they need care, they are given care. And we are really lucky that we have the ability to have a lot of specialties. I'll get to that in a second, but honestly, out of all the free clinics in Milwaukee, in a lot of cases, SCU has kind of the most expansive care because we have all these specialties that are run with medical students in that specialty. So, for example, dermatology, but they'll have a derm physician who oversees them and precepts those students. And it's, or we have, ophthalmology come in. And we just have all of these specialties that a lot of the free clinics just aren't able to provide. So really cool thing that we do. We, again, do everything we can to make our patients' care completely free, and if not, pay very, very little. They get free lab work that we can send over to our local hospital and our partnership with Ascension Columbia St. Mary's. We're located downtown Milwaukee. And we have a partnership with the Ascension outpatient pharmacy within the hospital as well. So if we have our own dispensary on site, if our formulary doesn't have the medication that the patient needs, we can send them off to Ascension and they can provide them the medication. At most, our patient would pay $10 for a medication, and that would be for like a really expensive brand name newer med, like for example, Jardiance or Trulicity, Ozempic are some maybe big names that you might have heard. SCU was established in 1991. Again, it's an interprofessional clinic. So once the School of Pharmacy started, they got involved with SCU and have been involved ever since. So medical students, pharmacy students, they run the clinic. They're on the board. Currently, we're really proud that we have, out of our 16-member board, two pharmacy students are on the board this year. So one is on the board and is our director of pharmacy student volunteers. The other is the director of dispensary. So they oversee all of the medication ordering, inventory, everything like that, oversee our formulary. And so it's really cool to see pharmacy involvement. And again, I oversee all those students, but they really run the clinic every week, which is just really cool. So here are some of the services that we offer. So like I said, we do primary care, we do specialty care. We do have Tuesday telehealth, as well as in person every Saturday. We provide patient visits. And as far as pharmacy, I've kind of highlighted on the right where we're really directly involved. So we do medication counseling, we do medication history and medication med recs. We provide immunizations. We have multiple in-house immunizations. We had to work really hard to do that. We have grant funds right now that we're able to offer that. I said free labs and then free or discounted meds. So I mentioned that we have an on-site dispensary. So we have a lot of volunteers. Every week we have one pharmacist who volunteers, and we have multiple pharmacy students in conjunction, of course, with lots of medical students as well. And we have that local Ascension partner pharmacy, and we do utilize prescription assistance programs as well. Basically, those are through the manufacturer. So whatever company makes the drug will offer for like newer brand name medications, often offer programs where if a patient qualifies through their income, they can get that medication for free and it is mailed to the clinic and we provide it to the patient. It's not available for every med, but we do try to utilize that program whenever possible. We have lots of volunteers. So this is data from 2024. We had 440 total volunteers. You can see the breakdown. We had 31 pharmacists, 31 pharmacy students volunteer with us. So, a decent chunk of our pharmacy class. And I always encourage students to volunteer at least once, but we are really lucky that a lot of our students do get involved. And 262 medical students, I won't go through all of it, but we are very fortunate to have all those volunteers and we could not run the clinic without them. So here are potential student pharmacist roles. So like I said, we have 2 current board members that are within the School of Pharmacy that are on that 16-member board. We have clinical pharmacy student volunteers. So these are the students that are going into every patient visit and they're doing a medication reconciliation to make sure that what we have on our med list in that electronic health record is matching what the patient is truly taking. We provide medication recommendations. So if we find, discrepancies or areas for improvement within the medication, or potentially a patient tells us about side effects they're experiencing, we can provide recommendations to the student doctors or the attending or precepting physicians for that day. And then we provide patient counseling and education on any medications that are prescribed. We also have a dispensary student position, and that is where, of course, you do more of what we usually see in pharmacy of filling those prescriptions, labeling them, and printing any educational material. So lots for pharmacy to be involved with. Here's just a few photos. The 2 on the right-hand side are our dispensary and what's going on there. We have a pharmacist. She is, her name's Elise. She's the redhead there. She volunteers with us regularly and she's checking those scripts. And then on the right-hand side, in the top right, that's the workroom where we have students as well as the attending physicians and pharmacists that are kind of talking about a patient care plan. And then on the bottom right is a patient visit that's occurring and a pharmacy student completing a med rec. So that is all I had.